Aphorism 60 Organon of Medicine. If these ill effects are produced, as may very naturally be expected from the antipathic employment of medicines, the ordinary physician imagines he can get over the difficulty by giving, at each renewed aggravation, a stronger dose of the remedy, whereby an equally transient suppression is effected, and as there then is a still greater necessity for giving ever increasing quantities of the palliative, there ensues either another more serious disease or frequently even danger of life and death itself, but never a cure of a disease of considerable or of long standing. A long footnote is added in the sixth edition as follows: all usual palliatives given for the suffering of the sick have, as after effects, an increase of the same suffering, and the older physicians had to repeat them in ever stronger doses in order to achieve a similar modification, which, however, was never permanent and never sufficient to prevent an increased recurrence of the ailment. But Brosio, who 25 years before contended against the senseless mixing of different drugs in prescription and thereby ended its reign in France, for which mankind is grateful to him, introduced his so called physiological system without taking note of the homeopathic method then already established, a method of treatment while effectively lessening and permanently preventing the return of all the sufferings, whose application to all diseases of a mankind, a thing that the palliatives then in use were not capable of effecting. Being unable to heal disease with mild innocent remedies and thus establish health, Brosio found the easier way to quiet the suffering of patients more and more at the cost of their life, and at last to extinguish life wholly, a method of treatment that seemed sufficient to his contemporaries. In the degree that the patient retains his strength, will his ailments be apparent, and the more intensely will he feel his pains. He moans and groans and cries out and calls for help more and more, so that the physician cannot come any too soon to give relief. Brosio needed only to depress the vital force, to lessen it more and more, and behold, the more frequently the patient was bled, the more leeches and cupping glasses sucked out the vital fluid, for the innocent, irreplaceable blood was, according to him, responsible for almost all ailments. In the same proportion, the patient lost strength to feel pains or to express his aggravated condition by violent complaint and gestures. The patient appears more quiet in proportion as he grows weaker. The bystanders rejoice in his apparent improvement, ready to return to the same measures on the renewal of his sufferings, be they spasm, suffocations, fears, or pain, for they had so beautifully quieted him before and gave promise of further ease. In diseases of long duration, and when the patient retained some strength, he was deprived of food, but on a hunger diet, in order to depress light so much more successfully and inhibit the restless states. The debilitated patient feels unable to protest against further similar measures of bloodletting, leeches, vesiccation, warm baths, and so forth to refuse their employment. That death must follow such frequently repeated reduction and exhaustion of the vital energy is not noticed by the patient, already robbed of all consciousness, and the relatives, blinded by the improvement even of the last sufferings of the patient by means of bloodletting and warm baths, cannot understand and are surprised when the patient quietly slips away. But God knows the patient on his bed of sickness was not treated with violence, for the prick of a small lancet is not really painful, and the gum Arabic solution Almost the only medicine that Brosio used was mild in taste and without apparent action. The bite of the leeches was insignificant, and the bloodletting by the physician done quietly, while the lukewarm baths could only soothe. Hence, the disease from the very start must have been fatal, so that the patient, notwithstanding all efforts of the physician, had to leave the earth. In this way, the relatives and especially the heirs of the dear departed consoled themselves. The physicians in Europe and elsewhere accepted this convenient treatment of all diseases according to a single rule, since it saved them from all the further thinking, the most laborious of all work under the sun. They only had to take care to assuage the pangs of conscience and console themselves that they were not the originators of this system and this method of treatment, that all the other thousands of Brossioists did the same, and that possibly everything would cease with death anyway, as was taught by their master. In this way, many thousand physicians were miserably misled to shed with cold heart the warm blood of their patients that were capable of cure, and thereby rob millions of men gradually of their life according to Broccio's method, more than fell on Napoleon's battlefields. Was it perhaps necessary by the disposition of God for that system of Broccio, which destroyed medically the life of curable patients, to precede homeopathy in order to open the eyes of the world to the only true science and art of medicine, homeopathy, in which all curable patients find health and new life when this most difficult of all arts is practiced by an persisting, tirelessly discriminating physician in a pure and conscious manner.